So that's that right there. So I just wanted to highlight a few things. But for the majority, people, their iron are fine. Your iron's fine. Calcium, we talked about already. Iodine, this is another important caveat to your thyroid. Now, your thyroid will take iodine, and part of it is to make your thyroid hormone. So what happens with individuals who go on a salt, oil, sugar-free diet, which is fine, don't get me wrong, but remember, in the majority of the Western world, iodine comes from iodized salt. So now you have an individual, and iodine can come in some other things, right? But it also depends on the soil. Like you might get in some potatoes, and you might get a little bit of iodine here and there. Depends also, maybe if you live by the ocean, you might have more iodine. If you eat, sea vegetables and some things, you might have other sources of iodine in your diet. But some people live, let's say they live in the Midwest, there's low sodium or low iodine rich soil, and they might end up with low iodine. And I've had, oh gosh, probably, I think now over the last years, maybe 10 to 15 patients who go through a very wonderful whole food plant-based diet, strict SOS free, come in saying, I was doing great, but now I was tired, and my doctor checked my thyroid. Remember that TSH was slightly elevated, and my doctor was worried. So like, why is my thyroid messed up? And did the plant-based diet do this? I was like, no. What happened was you cut out your iodine, right? You remove that iodized salt. And what happened is your thyroid didn't have enough to make, so now you become hypothyroid because you're malnourished in the sense of you don't have enough iodine. So you can take an iodine supplement, or you can do some sea vegetables. You do not need to take, please listen to me when I say this, do not take more than 150 micrograms if you're a non-pregnant woman. Now, a pregnant woman requires more. That's a separate discussion, but iodine is important. And again, you could do an audit of your diet by doing Chronometer or MyFitnessPal and measuring how much iodine you're getting by putting in your foods, and maybe you're getting enough, because you can't take too much, which is an issue, and you can't obviously take too little. So I wanted to highlight that for you. And if you do still consume salt, it's not very much. It's like one, I don't know, half a teaspoon to a teaspoon a day should be more than sufficient if it's iodized salt. The fancy salts, the sea salts, do not have iodine in it. It has to say iodized, okay? Zinc, again, this is important when you talk about zinc, selenium, and magnesium, because people cut out nuts. They become nut phobic. A handful of nuts is healthy. Everybody should be consuming a handful of nuts, unless you're allergic, because you're going to get some amazing minerals, which are important, again, for immunity, muscle contraction. If you're low in magnesium, you don't sleep well, you might get muscle cramps, things like that. Zinc, pumpkin seeds are fantastic. They have so many of these things, your walnuts, your cashews, all of those things. So please don't be afraid to eat your nuts and seeds. They're very important. They will lower your cholesterol. I'm not going to discuss, you get a lot of questions, but the evidence shows, when you look at the science, when you actually look at the science, eating whole raw nuts decreases risk for heart disease. Okay, I'm just going to state that. And if you look at the science, you're more than welcome to look at that. But that is really cool to see when people start eating these nuts and seeds, they have more energy. I will share with you my own personal story. I went on a very strict, low-fat, whole food plant-based diet. When I first went on a plant-based diet, I actually became depressed for the first time. Like, weird. It was not, I was not doing well. And I was like, something's not right. So I added back in whole nuts and seeds, and amazingly felt much better. So I just want to highlight that for you. Protein, we talked about. Homocysteine and methylmalonic acid can be indicators for you for B12. Now, I have never seen, even except one time, that one lady that I spoke to you about had super low B12. Her methylmalonic acid was elevated. But what happens is homocysteine requires B12 and 2 other B vitamins to get further metabolized, and methylmalonic acid also requires B12. And so what will happen here is that you will see these two are elevated with low B12. And what's interesting, you could see an elevated homocysteine even with a normal B12. So you up it a little bit, and if you don't see the homocysteine dropping, there are some other things that can also cause homocysteine to be elevated. And why is that important? Because people who have elevated homocysteine are at higher risk of stroke. There was a study done with the UK. These were ethical vegetarians. They were not supplementing B12, and they had a higher stroke risk than their omnivorous counterparts. So again, your homocysteine, we want it less than 10. And like I said, methylmalonic acid, I've only seen elevated one time in an extremely rare case of a super low B12. So those are the things there. I'm a little bit over my time as far as that. So I'm going to make some final recommendations. Test, don't guess. Supplement B12 regularly, no exceptions. I hope you guys got that. Supplementing with vitamin D and algae based on your labs. Pay attention to protein, especially as your age. 1 gram per kilogram, 2.2 pounds per ideal body weight, which is the BMI of 22, in my opinion. Eat a variety of food categories, your legumes, your whole grains, your vegetables, your fruits, your nuts and seeds, and the colors of the rainbow. You get so many beautiful phytonutrients from eating all the colors. And if you don't get it one day, just go after the next, right? Go think about it as week chunks, right? Because like I said, I understand it's hard to do everything perfectly every day. You're not going to fail, but try to do it within that 7-day window, okay? Regularly. Make it a game. Pay attention to your body. If you were feeling good and now you're not, something's going on. It's signaling you signals. Discuss with your doctor any medications because they can be decreasing your absorption of iron, they decreasing your absorption of B12, things like that. Stay hydrated. You'd be amazed at how well things move along with just drinking more water. Oh, test iodine. If you do test iodine, it's not a blood test. It's actually a 24-hour urine collection. And I would only go put you through that because the iodine in the blood is kind of like the calcium. Your iodine is going to be a little bit more tightly regulated. It's not going to necessarily show up high or low in blood, but in the urine, it will. And especially just test your thyroid. If it's a little abnormal, go ahead and test your iodine then. Menopause can throw a monkey wrench into your labs. Seek help if you're having symptoms. Because trust me, it can be crazy. And understand a whole food plant-based diet is not a panacea, but is as close as I can get. So, 93 minutes. Okay, that's it. If you have any questions, please visit drmarbas.com. I also write a daily Substack, which is basically a newsletter. I talk about habits and lifestyle medicine. And if you go to drmarbas.com, you can go to my weekly newsletter, which is more plant-based. I give recipes and anyway, but these are the places you can hear from me regularly. You can also make appointments to see me as I am licensed in all 50 states and DC. So I'm happy to go back to answer Q&A. I'll stop sharing.
All right. Thank you so much for sharing all that wonderful information. And
You're
since
welcome.
you're the last speaker of the conference, whatever you say is the final word, and that's what one should listen to,
Take
right?
your B12. That's my final word.
All right, beautiful. All right. Well, let me ask you on B12. Does it matter what type? We got the methyl and you have the cyanocobalamin.
Yeah, unless you have, MTHFR genetic issues, you can take the cyanocobalamin. It's much cheaper, easier to come by. Yeah, so, but some people, if they want to take the methylated and the dinostil, there's different ones, but those should be fine. Either
Okay.
way.
And do lab results vary based on the lab that does the testing?
A little bit for sure. But I would try to stick to the same lab if you can, just because the reference range will be the same. But for the majority, it should be okay if you have to go to different labs, but it is easier if you do the same labs because they'll have all of them together as well.
So you can basically track the trend as opposed to
Yes.
a
Yeah.
specific number.
And they'll so many times will have like your previous and they'll put the trend on there for you. But for the most labs, if they're reputable labs and they have the certifications, I like Quest and LabCorp. I have a national account with them. For the majority, those are fantastic.
So there's Michael Pollan talks about something called orthorexia where people drive themselves crazy trying to eat the perfect diet.
Yeah.
Do you see people driving themselves crazy trying to have the perfect lab panel? Does perfection matter as opposed to the trends and whether or not they're symptomatic?
Yeah, exactly. So because what's perfect for one person is not going to necessarily be perfect for someone else. So let's say someone's doing beautiful, they have arteries look great, but their cholesterol might hit 180 total cholesterol, right? And they're like, but I was told that I needed less than 150. But let's look at all the data and how you're doing in this particular, stage of your life. You're doing fine, right? And so, and they got off medications and their blood work is right. But yes, you will see patients go crazy, especially when they listen to a lot of different quote unquote the gurus and they think they have to, and there's conflicting evidence and conflicting, you need to do this and you need to do that. I was like, listen, you need to just eat plants, and then as long as you're eating those variety and those colors as much as often, and we'll tweak it accordingly based on your habits. So like I was telling before, that one individual is eating 12 times a day, ended up with some crazy labs. Or if you cut out, the iodine, and unbeknownst to you, now some things happening. Or if you're menstruating, having heavy periods and your ferritin's low, and you're like, your hair is lost, and you're just like, oh, it's the plant-based diet. It's like, well, not really. This is what's going on. And, usually there's an easy fix. But yeah, I call it the guru syndrome. I usually speak that at least 2 or 3 times a month, just because patients are like, when I try to do this and then that, and I heard this, and they read too much, I think, almost. Not that you shouldn't educate yourself, but yeah, it shouldn't be that hard. This just shouldn't be that hard, just to eat well.
Yeah, I feel that sometimes having, listen to a whole bunch of different people with a whole bunch of different opinions can be as detrimental as listening to nobody because it
Exactly.
becomes very confusing. You don't know where to go, and then you basically blindly pick somebody and you don't really know if they're right.
Yeah.
Um, so what about things like testosterone?
It depends, right? So it's not going to be necessarily affected by a plant-based diet. If anything, you should improve, right? And so unless someone is malnourished, in the sense of not eating enough calories or being too restrictive, um, for the majority of men and women, their testosterone should not be affected.
Okay. And you had made a point, and I just wanted to get some clarification. Basically, we're a very sick country, and
Yes.
the ranges are based on what's normal, not necessarily
Yeah.
what's healthy.
Right.
How do we know what the healthy ranges are? Like, so in a healthy population, what should be the healthy range?
Um, I think for the majority of individuals, when we look at the references currently outside of the cholesterol labs and maybe the white blood cells, I think what we see is sufficient enough. But the problem is we throw drugs at people before we like, well, can the diet fix what we're seeing first?
Mhm.
And unfortunately, doctors, even if they're plant-based doctors, they say go eat plants, and then they don't understand the nuances of, one, is it medications? Do they need decrease? When people don't do well on a plant-based diet, there's always a reason. And this is why we need to dig a little deeper in the layers. And that's, I've done 13 years of labs and patients and stories and hours of, I don't know, thousands of hours looking at this stuff. And so that's the value of having these type of discussions, so people can educate themselves, because their doctors probably don't have had the opportunity or the understanding, of what these labs mean and what they should be doing.
So you just mentioned that if you're on a plant-based diet and you're not doing well, there's always a reason. Um,
Yeah,
so often you hear people say, "Oh, I was on a whole food plant-based diet, but I had to introduce meat back. I felt so much better when I ate meat."
yeah,
And then they go into, "Oh, it's not for everybody. Some people have, there's different types of people. Some people have to eat meat." What might be the cause of why they are feeling, assuming that they are feeling better actually, and it's not, placebo, that they
yeah.
are feeling better? And what are your thoughts on the idea that, you have a species, and unlike any other species in the world, we can have completely opposite diets?
Right. No, exactly. So that's a really interesting to think about. As human as our anatomy, like when you look at comparative anatomy, we are made to be herbivores, right? We have the teeth, the digestion of herbivores. The interesting thing about humans is that we can survive in some very extreme climates, and that's to our benefit to populate the world and survive. So that's what I would highlight there. The important thing to understand is when people don't do well on a whole food plant-based diet, we have to look at what they were eating, what they were supplementing, what other medications could they be on, and other things. So there's multiple things that could be going on here. Maybe they're not taking their B12. Maybe they've cut out all beans because they became too bloated. Now they're low protein or not enough calories. Maybe they're like my first few patients because they had a naive plant-based doctor who's like, just go eat plants, right? And didn't quite understand the nuances of importance in eating that variety and category. So again, or maybe they're having heavy periods and they're not eating enough iron, right? So they have, hair falling out and they're fatigued. So there's so many variety of things that could be going on. That could be a simple conversation, some labs, some tweaking, and they feel great. And so That's the important thing to here to understand. Or maybe there's something else going on that just coincided with their transitioning to a plant-based diet. And so again, lots of things could be going on, but someone who doesn't do well on a plant-based diet, there's something going on. And it's either the quality of the diet, maybe they're eating a lot of ultra processed foods, because now, when I went fully plant-based, there wasn't too many plant-based vegan options, but now people eat, they're eating Impossible Burgers, or they're eating fries, and they're like, well, this is plant-based. It says plant-based. I was like, whole food plant-based. The whole food's really important. So again, I would say it's really important to look at the entire story, what was going on. It's almost like you have to be a good detective. But yeah, there's usually always a reason.
Are there limitations of the testing? So you'll hear stories of people who had their heart checked and they got a whole bunch of tests done and everything was perfect, and then a week later they have a heart attack.
Sure. So let's say that you have someone who had for some reason had, let's say did a stress test and some other things. Or again, if you have someone who's very ill and they transition to a plant-based diet, you're still needing some medications, maybe potentially, because you shouldn't stop all of your medications suddenly, because they still probably have active heart disease, right? Because we're not dealing with a baby and raising them to eat a plant-based diet their entire lives. We're dealing with someone who spent 60, 70 years eating a horrible diet, was very ill. And so, yeah, that could be part of it. Or you could have someone who had a fine stress test, and then they flicked off a nice little, piece of cholesterol. It was down there, and it blocked the clot formed and caused a heart attack. I don't know if you guys know about. I don't know if Dr. Loam, Stephen Loam, was he a guest on your guys? I don't know.
Not
You had
not this year. I'm familiar with the name, but yeah,
he's
I think we may have had him in the past, if I'm correct. But he wasn't.
fabulous story is explained here. He's a cardiologist who lost a lot of weight, went plant-based. He's in California now. But what was interesting, he ran a half marathon with his kids. Did you hear that story?
Go ahead and tell, but
Yeah,
yeah, there was two guys, right?
two
That
people had a cardiac arrest right in front of him, and he's a cardiologist. So he revives two people. One, I think at mile 3 or so. I interviewed him on my podcast if you want to listen to it. He ended up being on the Today Show and stuff, but he revived one person, gets back up and keeps running. He crosses the finish line, and then someone has
yeah.
another cardiac arrest. He saves both of these people. They both go plant-based, right? So here's these two fit enough individuals to run a half marathon. This is for me, this is God, the universe saying, you need to be in front of this person at this time to be saved. But anyway, they transitioned to plant-based diet. They ended up running another half marathon together. They do beautifully, their cardiac test. So when you're under the care of individuals, they ended up being happen to be in front of someone, but that could say, may have a very fit individual and have heart disease, again, because just because you look fit on the outside doesn't mean you're fit on the inside. And so that's why it would be important to do certain tests, especially if you have high risk of family history and stuff like that.
Yeah, I think the quintessential example of that was the runner. I think his name was Jim Fix back in the
Mm,
early 80s. He was like one of the fathers of the running movement that kind of launched
mm,
it around the country. And he would brag about that he could eat anything because he was in great shape. He ran all the time, and he was a celebrity because of how much he ran. And then I think at like 42 or 44 dropped dead of a heart attack.
yeah,
But
yeah.
he was eating a tremendous amount of calories, and it was whatever he felt like he wanted to eat. So
Yeah. I think there was also a guy, was it maybe The Biggest Loser or one of those shows? He was like a celebrity trainer, really fit looking guy, had a massive heart attack in the gym and someone saved him.
wow.
I think he ended up going plant-based as well. But yeah, exactly. You can look aesthetically wonderful, but be very sick on the inside.
So for people who want to go whole food plant-based, what things, not just how to get started, but what would give people the biggest bang for the buck?
Oh. If you had to be the biggest lovers, I remember there's two types of personalities. One who can go fully plant-based overnight and not be stressed about it, right? They just do it. That's like what we did.
Mm.
Then there's a lot of people too that need to slowly kind of move into the plant-based diet, which is a lot of people because there's a lot of moving parts in their lives and they just, they don't want to get overwhelmed. So I would say the biggest bang for your buck, one is just adding more vegetables and fruits and beans and whole grains to your diet already and thinking about what meals or recipes that you make regularly that you are already plant-based that you can elevate and continue. Maybe think about, anywhere between 7 to 9 recipes that you can rotate weekly, regularly meal prep and not feel too overwhelmed. It doesn't have to be fancy. The other thing to understand is spices and herbs are your friends. They can really elevate a dish, but again, sometimes people just need to be very simple to begin with. But if you're already eating something that you love that's plant-based, keep going, right? And then I see if you had to pick meat or dairy, the first one that I would remove is dairy because that is so inflammatory. You'll see a dramatic improvement in just how you feel. If you're like, I can't go fully yet, what should I do? It's like we can get rid of the dairy products, the milk, the cheese, those things, replace them with some plant-based alternatives, at least in the beginning. I always say that would be a huge, huge, huge and thing. Of course, make sure you supplement that B12.
So, that's interesting about getting rid of the milk first. I think that might also be a good idea because if you ask people, what their holdout is, it's always cheese, right? That's
Mm,
the hardest thing. So if they get rid of the dairy while they still have the meat, maybe at least they have something that they can kind of hold on to. And then the meat, I think, is generally e easier to give up to. So once they give up the cheese, they can move over to the meat.
yeah, cheese is definitely one of the hardest. That was
Yeah.
that was my interesting thing that it took me about 3 months to stop thinking about cheese, and then it's just like, eh. But
It's
you just
my
like, I had cheese on this. That would have been kind of good right now, but I'm not going to eat cheese. Those
what,
conversations going on.
what are your thoughts on the casomorphine aspect of it that people
Yeah,
chemically addicted
100%.
to it? Yeah.
Yeah, absolutely. So let's think about this. So if you breastfeed a baby, and that baby goes to sleep. Why do you think that baby one searches for that? Because it feels good and they go to sleep. It's the case of morphins, right? And so the same thing occurs when you drink cow's milk or what other milk that you choose that came from an animal. And I'll tell you a quick little story. So I had this one patient. She was 8 when I first saw her, and her mom. And she had horrible eczema since infancy, had been to multiple dermatologists, been on oral and topical medications with no avail. And if you were to look at this child's skin, it was like her entire backside and her legs were like almost like a tortoiseshell. It looked so rough and just she was didn't want to go to school. She was embarrassed. She just was horrible, didn't feel well. And her mom had seen me telemedicine wise, and we talked. I was like, had anyone talked to you about the diet? And of course they didn't. And so we talked about a plant-based diet. And of course, within 3 weeks, come back 100% gone, and the little girl had lost about 5 pounds, which was interesting due to inflammation, but her skin resolved. But I always told the little girl, because I knew she would be running into some interesting things in school, I was like, this is what you tell people. You are not a cow. You're not a baby cow. Cow's milk is for baby cows, and you're not a baby cow the last time you checked. And that's what she said every time I saw her. She's like, Dr. Marbas, I told my friends that I'm not a baby cow. I was like, that's fantastic. You keep going. Anyway,
That's
so fun. But to see the eczema improve, that inflammatory response is so incredible. And when you're a family practice doctor or a pediatrician and you have small children as patients, they will tell you're checking blood to make sure they're not anemic. And you know why that is because when they drink milk, whole milk, it causes inflammation in the gut, and you'll get these micro bleeds, and you can see some anemia. And the first thing they tell you is to tell your patients to decrease their milk because they're too inflammatory to the gut. Like, why would we tell someone that it's ever okay to drink something that's causing inflammation that can cause anemia in child? Like this, it boggles my mind. It's like this is not normal. Anyway, so yes, that's why I say milk because it's so inflammatory.
yeah, the cognitive dissonance in the medical industry with regard to nutrition
It's
is shocking.
astounding.
Yeah.
Yes, yes.
So when someone goes whole food plant-based and they start getting really clean and therefore they start losing weight, is
Yeah.
there any detox symptoms that they might expect?
It really depends. Some people feel amazing right away, but some others, they will maybe have almost flu-like symptoms for anywhere between 2 to 3 days to 2 weeks. And I would highlight many times this can be related to medications that need to be decreased. And if I could please just, I know one of the questions that were received was like, when do you know to start decreasing medications? I'm going to give you two types of medications you need to be decreasing and monitoring very closely is your blood pressure and your blood sugar. So if you're on either of those type of medications, it's really important that you let your doctor know that you are eating this very healthy, just say higher fiber diet. You don't even have to tell them plant-based if you're concerned about that, that you're eating more fruits and veggies or whatever. And as your blood pressure begins to decrease and it drops below 120 on top regularly, so I'd say like 3 days in a row, you might need to tell your doctor, hey, can we talk about decreasing this medication? Now, if it's definitely into the lower 1 teens or in the under 110, you definitely should be decreasing some of those medications. And let's say that now you were feeling okay. Now suddenly you feel dizzy upon standing, or that you're feeling like, man, I just don't have any energy. Check your blood pressure. And then I also want to highlight this can also happen. I had another patient who went plant-based. She cooked meals for her husband. Her husband was not my patient, but guess what? He was on the same medications as his wife, blood
Hmm.
pressure medications and such. She's like, Dr. Marbas, I was decreasing her medications, but I want to talk to you about my husband. He was feeling really well, but now he's so tired. I was like, is he on blood pressure medications? She goes, yeah. I was like, did you check his blood pressure? Because, that's interesting you asked. We checked it the other day. It was 96 over, I don't know, 60 or something. And I was like, is your husband there? Can you bring him? It's like, can you bring him on over to the camera? And so we talked. I was like, listen, I'm not your doctor, but I would ask you to hold your medication and you need to call your doctor. This man is like 6'2". Your blood pressure shouldn't be hitting the 90s, but if I have tinier ladies, let's say they're 5'2" or 5 foot, it's normal to see, lower blood pressures. So then they get nervous. So like, maybe they were running into the 115s most of the time. Then they go plant-based and now their blood pressure is dropping, but they're still feeling really good and good energy. And I was like, that's actually okay for you. You're like 5 foot, 0 pounds. My blood
Right.
pressure runs like 106 over, 60 something. I'm 5'7". And so again, you want to check. Now the other one is your blood sugar. So if you're on things like insulin or what we call oral hypoglycemics that drop blood sugar, you're going to need to decrease your medications. And with insulin, especially, very, very serious. If I have somebody who goes all in, and many of my diabetics are kind of at that point, they're like, I need to go all in, and I'm fantastic. But I'll eat, depending on what dosage they're on, how severe their blood sugars are still high, I may decrease their medications by half or even more, depending on where they're at. Because the closer they are to being pretty well controlled on the insulin, I need to cut it back even further. But if their blood sugars are still really, really high, I might cut maybe 25% or something. I can always bad back medication in. But if your blood sugars are consistently under 150 and you're on insulin or oral hypoglycemics in the morning, your fasting blood sugars, it is time to start cutting down your insulin and your blood sugar medications. So those are the two things I wanted to highlight to keep people safe.
You mentioned in your presentation that doctors are really good at incrementing up medications.
Yeah,
Are they, you know what you're doing because you've been doing it for years.
yeah.
Do they know what they're doing?
There, it depends on the doctor. If you have a doctor who understands that lifestyle can be very, even if they don't understand the nutrition, but if they understand people who get well don't need medication, they will start looking at that and be more careful. They certainly are, many doctors will be able to navigate that fine, but they don't understand sometimes how quickly it can affect. And like I didn't, right? I knew to be aware of it, but I didn't realize how quickly. But you learn pretty quick. The other thing is there are some doctors who are adamant that you need medication, even though you don't need medication. And sometimes I've seen that with blood pressure medications. Sometimes I've seen that with blood sugar medications. Their doctors actually told them, go eat more. You're going to stay on your insulin, eat more. I was like, what? I was like, what are they from the Twilight Zone? That makes zero sense.
Right.
And
Yeah.
so, anyway, because they're just, it's mind-boggling sometimes. But I would say the majority of physicians are going to be at least somewhat aware that if someone gets healthier, they're going to need less medications. But I do have some interesting cases where they don't.
So you told the story of the pediatrician of the 12-year-old girl with fatty
Yes.
liver disease.
Yeah.
Did that girl ever go back to the pediatrician after she went on a plant-based diet and her fatty liver
The liver
issues went away?
specialist, yeah, they
Yeah.
did. And so then the liver specialist said, oh, just keep doing what you're doing.
I
I
never, I
never got a
mean,
call. I never got a call. I never got any, like, I would be curious in myself. Oh, let me call that doctor and see what they did. This is fascinating. I could help more kids. No, no. I think ego is a big piece of this. I think dogma, and because we're human too, right? Doctors are human too. And
do they treat it like you
unfortunately,
just got lucky? Like you just got lucky? Like, oh, whatever you're doing, you just got
just
lucky.
keep doing it. Yeah.
Yeah.
Instead of going, wait, what's going on here?
Yeah, like I can help other patients. Wow.
Exactly.
To
This is
help
so
people
fascinating.
instead of manage their
Yeah.
disease.
Hey,
Yes.
if you have a doctor that gets offended when you try to help them or educate them, people who think they know everything, you need to walk away and find another doctor. Because I would say the most thing that a trait that I've always tried to hone in is understanding that I can't nor will I ever know everything. So I need to have an open mind to possibilities. Now, I might go investigate something and understand, hey, I was right, I shouldn't do that. Or I might go, whoa, I need to learn about plants. And 12, 13 years later, here you are. So again, you need to have some humility and because there's lives at stake here. And I take that very, very seriously.
We had a great speaker earlier today, Dr. Ellen Langer from Harvard. She's a psychologist, and she was
Uh-huh.
basically talking about how, certitude basically prevents you from learning, and you don't know anything. You just know
Right,
what might be correct for most people.
right.
So that's great. So we only have like about a minute left. In that 1 minute, can you tell what type 1.5 diabetes is?
Yeah, absolutely. So, let me go back a little bit. Is it okay if I go over just a hair?
Yeah, sure.
So I started seeing a lot of mastering diabetes patients years ago when we first launched plant-based telehealth, because we ended up selling that to John Mackey and it's now Love Life. That was its precursor was plant-based telehealth. I opted to go out on my own and we sold it. But during that time, Cyrus and Robbie sent us a ton of patients. And these were individuals who didn't do well on a plant-based diet. Like I said, there's always something going on. They were healthy. They were eating a very healthy plant-based diet. You look at their food diary, they were of healthy weight. But you might see blood sugars hit 300. And they're like, what is going on? I was like, huh, interesting. So we check C-peptide, we check a fasting insulin, and lo and behold, they're not producing insulin. So now what we see is this, it's not a rapid onset of like type 1. So typically type 1s as juniors, when you're kids, you'll see they end up with the flu or something or a cold, and suddenly their immune system has attacked the pancreas. There's no insulin production. It's very quick. They end up in the hospital with blood sugars over 1,000. They're in, metabolic acidosis. They're having rapid breathing. They're having all the classic symptoms of a really high blood sugar very quickly. Now, these individuals will be typically over 2 to 3 years. It will take them. You'll see this incremental increase, but typical medications, the oral medications like metformin and some other things do nothing. Or you'll have someone, like I said, that are healthy and suddenly now their blood sugars are super high. These are what we call type 1.5. They're an adult onset of this autoimmune diabetes. And what I will see is we're misdiagnosed as type 2. And you can also check their insulin antibodies. Typically, they're elevated, like your GAD65. There's 5 of them total. And so, yeah, you'll see a low C-peptide, which is a little part of the insulin hormone that's chopped off that will last around 24 hours. It'll tell me if that's low, typically less than 1 or so, or 0.8. That's an indication that, and they have elevated antibodies, that this is my type 1.5. So it's just an adult onset of the autoimmune diabetes, but it's a longer journey. And each person requires different insulins potentially. And there are some medications you can give orally that may decrease or slow down the progression. But yeah, so that's what that type 1.5 is.
Okay, so basically it's type 1, but just sort of a different way of getting there at a different time period.
Yeah, you
Okay.
could say that.
All right, perfect. Well, thank you so much. That concludes
Yeah.
not only our time together, but the entire conference. So I want to thank you for a phenomenal presentation, great Q&A. Really appreciate all the information that you shared. Please unmute the audience so they can share their appreciation for the doctor.
Thank
you
you so
sending it to
much.
him.
Thank you,
Thank you
Dr.
all
So
so
much.
much.
Very comfortable.
Thank
Steve,
you
thank you,
all.
Mike. Thank you, Zuri.
Have a
Thank you,
great
Marbas.
time.
Thank
Thank
you,
you.
Val. Thank you for everything.
Bye.
Thank you.
Bye.